Good afternoon, everyone. I realise that I'm the only person now between you and your dinner, and so I'll try and keep to time. So, my name's Professor Alison Metcalfe. I've worked for more than 30 years in both academic research and also in the NHS in clinical spaces, working with families, looking at how we support families who are really sort of struggling with their mental health due to a variety of reasons. You know, sometimes it's due to illness, long-term conditions, genetic conditions, sometimes due to bereavement. And during the time, the 30-odd years that I've been working there, one of the things that I've done a lot of is sort of co-design work with families to design interventions that actually help them. And I couldn't have asked for a better talk with William Bird, sort of setting things up really, because he talked about feeling safe, feeling you belong, feeling valued, and the trust that builds. And I would say that's absolutely fundamental to children and young people's mental health. And that's something that I've certainly observed in the last, as I say, more than 30 years. And I got really frustrated, if I'm honest, with the sort of academic and the health systems. And so one of the things that I was determined to do was, before I retire, I thought I'm going to put together all the knowledge that myself and my colleagues all over the world have come up with, and we're going to find a way of digitising the mental health and systemic family therapy at that. And that's what I've spent the last 3 or 4 years doing, working with colleagues, working with families to look at how we sort of build things going forward so that we can reach more people as and when they need it. The current state of play is shocking. 1 in 4 young people report a problem at the moment with their mental health. 56% say they receive no help or limited help from CAMHS despite referrals. And self-harming young people are 49 times more likely to die by suicide. Those are shocking. And I know the NHS is under severe pressure, but I think one of the things that I'm really keen to do is to work with the NHS and try and find ways of delivering services differently by working with families to build that trust within the family so that the families realise and recognise that they've got the strength and the resilience within them to sort of help their children and young people with their mental health. So I think one of the things that we've talked about a lot today is about the evidence base and how we use the evidence to best effect. And one of the things that I've certainly done throughout my career, as I say, is look at the evidence, build on the evidence, and use evidence to sort of generate interventions that people want to use and will use. And we've spent a lot of time talking to families over the years. I reckoned it up a few months ago, and I've spoken probably to over 2,000 families during my career. And so what I've tried to do is take all the learning from that and work with my colleagues in our digital health company, LOHA, to look at how we can sort of deliver those interventions to make them accessible when they're needed and make them as cost effective as possible so that they can reach as many people as possible as soon as they're needed. Because one of the other things I think is that, you know, families will begin to have concerns about their young person's mental health, but it might take many months, if not even in some cases years, before they can actually get a referral to a mental health service provider. But if we could help the families the minute they begin to suspect that there's a problem, that could really transform that family's experience. It could transform that young person's life and actually help them develop the resilience, because they would be feeling safe and they could actually move forward with their lives rather than get stuck into a cycle of poor mental health that just sees their mental health spiral down and down. I'll tell you a little bit about Kate and Amy's story, because I realise you've had a lot of statistics today, so I want to talk to you more in terms of some of the stories and the narratives that we hear. So Kate approached me last year, and this was when we were still sort of building and designing LOHA. And Kate was in a school. She got a 10-year-old daughter, and she said to me, my daughter, she's been in and out of intensive care now twice because she can't eat because her anxiety is so bad. She's got nervous tics. She gets bullied, so often doesn't really want to go to school. And I'm at a loss to know what to do with her. She's going to transition to a senior school shortly, and I just don't know what to do anymore. And she said, can I take part in your LOHA programme? And I wasn't sure, if I'm honest, at first, because I thought, gosh, you know, this child sounds like she's really struggling and she's really ill. But she said to me, we've seen 4 psychiatrists. We're part of the CAM services, but nothing's really helping. I need your help. And she said, just even being able to sort of being part of this research, I'm really keen to take part. So we agreed to let her take part, and I'll tell you a little bit more about what happened with Kate and Amy. So one of the things that I suppose that I've realised a long time ago, is that a lot of mental health problems, certainly in young people, is a result of distress, and that distress can be either conscious or subconscious. And I know we talk a lot about, ACEs and I suppose, many of those adverse reactions or adverse events are sort of driving a lot of that distress. But nevertheless, I think it just really comes down to an awful lot of distress. And a lot of the talking therapies really work because one of the things that they do is help you process that distress. And we come from a point where we say, okay, so why can't we encourage families and support families to be able to talk about the difficult conversations, the difficult situations that children and young people find themselves in, and the experiences that they have. And so we've very much built our interventions around that, having seen them be very sort of successful in terms of the work that we've done in the past. And one of the things that we've done is tried to design a range of digital activities that parents do with young people that helps young people articulate their feelings, their thoughts, help them begin to process and manage those feelings and thoughts. And what we find is that by providing parents with those skills to sort of communicate much more effectively with young people, we help parents listen better, help them understand, be more empathetic, and that really helps young people manage their distress feelings and manage their mental health very, very effectively. And just to put some context onto this, I mean, as I said, it's all evidence-based. I've ran 4 focus groups with young people from a range of backgrounds. So there were about 50 young people that took part when we were designing these interventions. I interviewed 41 parents to sort of get their perspective on this. So you can see it was a sort of, the fundamentals of the whole sort of that co-design process that we talked about a little bit earlier. There were 23 families that then helped us co-design LOHA and LOHA's activities. And there's since been another 23 reviewers of the LOHA programmes, including clinicians. And all of what we've developed is based on systemic therapy or family therapy. And we know that systemic therapy and family therapy is very effective in a large proportion of cases. When it's compared with CBT, it's often much more effective than CBT. And we know a lot of digital mental health services just really focus on CBT. And this, as far as we're aware, is the first time we've been able to produce a digital form of systemic therapy. So our programme, it basically is a digital programme. It runs for 6 weeks. Parents get a digital activity delivered to their phone, and they get a week to 10 days to actually do the activity at a time that suits them and suits all the family. And each activity takes about 30 to 60 minutes, depending on the numbers of family members taking part. They get lots of access to e-books and other resources. And then we also put in a coaching session so that parents can take part in an online coaching session if they've got questions, if they want further advice or further information. And basically what they do is they simply follow the digital systemic therapist's prompts, which takes them through the range of activities. And I can show you a little bit about that in an animation that we've developed. Hopefully it will start.
Anne was really worried about her daughter, Sophia, who had become anxious and withdrawn, often retreating to her room after school. Desperate but facing a 2-year wait for CAM's help, Anne discovered LOHA, an organisation supporting parents to help their teenagers manage mental health through a blend of human and digital resources. LOHA offers evidence-based programs, combining guided activities designed for bringing parents and teens together to talk about feelings, along with support from online sessions for parents. Anne attended an introductory online session and was impressed with the in-depth, practical advice immediately available, and she enrolled in the LOHA programme. The activities which Anne and Sophia could engage in at their leisure utilised creative and visual ways of helping them develop curiosity, deeper understanding and empathy with each other. This deeper communication enables Sophia to express her thoughts and feelings openly, helping Anne provide targeted support and strategies for resilience. With LOHA's ongoing support, Anne watched Sophia transform into a confident teenager, enjoying life and able to process her feelings more easily. Anne said, "Something special happens here. Visit our website to see how we can help your family grow stronger together through cure, connection, understanding, resilience, and empathy."
Okay, so as the animation described, they're basically digital activities that parents and carers do together with young people, and it really gives them, really great insights and helps them really connect with the young person. And I think the activities allow families to discuss feelings and thoughts in a very sort of relaxed environment within their own home, and it also means that they naturally create opportunities to talk much more openly and in a much more sort of engaged way. And what we've seen is so far that the families communicate really sensitive topics, that it gives them a chance to really open up and discuss things. And it's been really quite transformative in the way that families have been able to get to the root of many different aspects of young people's distress as a result of being able to do the activities together and deal with the sensitive situations. And it also really empowers the parents, because I think sometimes the parents feel such a loss about not knowing what to do. They feel like, I'm the parent, you feel it about your children. I feel like I need to be able to put things right for my children. And if you can't do that, you feel very lost sometimes and very afraid, and that impacts on your young person's mental health as well. But this is a real strengths-based approach. It really, helps parents grow their confidence, and they begin to realise that they can deal with many of the situations that many of their children and young people are facing. The activities, they involve drawing, noting, discussing, planning, acting, reflecting, all kinds of different ways of communicating. But The other thing it does is really help young people recognise their own strengths, and it helps them recognise the resources that they have around them. So it's very much about building their resilience going forward, which again, sees their confidence and their self-esteem grow. So we talk about our CURE model, which is about connection through curiosity, the U for understanding, the R for resilience, and the E for empathy. And those have been the sort of core foundational stones of all the activities that we've developed amongst the clinician group with the families. And I think one of the things that digital systemic therapy then provides, very similar to family therapy in general, is that it gives them the ability to deal very positively with emotional distress, helps them recognise the sort of full range of emotions and how to use them and what they actually mean, and gives people that sort of emotional intelligence that we talk about, but is often missing from the day-to-day sort of education and development of people. It really facilitates very supportive family relationships. So we see benefits through the whole family. So all of the parents have reported positive improvements in their own mental health as well as the young person. And as I say, we've used the digital approach with 23 families so far. Every single family has reported a massive improvement in mental health. The young person has reported a significant improvement in theirs. And in fact, we've had young people that were on the CAMHS waiting list actually take themselves off because they didn't need to go anymore. It was that profound a change. It enables sensitive conversations. So, and families can. These are skills then that families can keep practicing, keep using, and it means they can solve all kinds of other problems. It's not just about putting one particular problem right. And it grows, as I say, grows capability and confidence, and families learn to adapt. And we know adaptation is a big part of resilience. And the benefits of creating that sort of open family communication, there's a shared reality, because often what I've certainly found in much of my research in the past is that sometimes parents try and protect their children and young people from knowing what's happening in a situation that's affecting the family, particularly around sort of death and dying, and then the young person gets very confused and just doesn't understand, and that causes enormous amounts of distress. There's the psychological safety that we've talked about. There's the idea of solidarity, the idea of bringing families together, that they feel very much that they're in this together. And it also reduces a lot of the stigma that we see around mental health, because although we talking about mental health far more, there's still a huge amount of stigma in many of the families that we work with. I think also being able to talk more openly, and because of the activities the families do together, they get new perspectives on things. One of the things that parents said to me on numerous occasions was that they hadn't realised how wise their teenagers were, and how their teenagers could see things and see things from a different point of view. And they actually learn to have sort of, a stronger relationship in trusting the teenager to get their view and their perspective on something that was happening in the family. And as I say, and that really sort of reinforces and builds all of that self-confidence. Then at the end of the 6 weeks, parents can graduate from the programme, but they're not alone. Most of the parents stay with us, and they continue then to help each other. What's really interesting is that about half of the parents have now gone to work in mental health services themselves, because they've seen the transformation in their own families and realised that they've got something as well to give. We've built their self-esteem, and I think that's really, really great news for the health service as well. And that's just a summary slide of saying what we can bring. And so if I tell you about Kate and Amy, sorry, I'm getting a bit emotional about this because Amy is now completely transformed. She's almost 12 years of age. Her body weight is normal for the first time. She did the programme with her mum. Her mum, after the third session, her mum came to one of the coaching sessions and said, I realised a lot of Amy's problems are because of what's gone on with me, my past, and the traumas that I've gone through. And she said, because she can now talk to me about how she's feeling and about what's happening, we've had such close, connected conversations. She said, my child is just transforming in front of my eyes. But you know, sort of 12 months later, Amy, as I say, is loving school, never misses a day. She's lost the nervous tics. She doesn't get anxiety anymore. If she does feel a bit worried or anxious about something, she's got lots of tools, and she talks to her mum about what she does to manage that. And she's actually been discharged for the first time ever in her life from any kind of hospital care because, you know, she's living her best life, as she says at the moment. So we can't ask for more than that. So there's lots of testimonials. I don't know where that middle bit in the slide has come from.
Do you know, I think that there are different presentations.
I was going to say that the middle bit with all those circles, I've no idea where that's come from. But anyway, so we've got as I say, some great testimonials from the families that we've worked with so far. I think sometimes people come, they're a bit sceptical whether digital's going to really work for them. But actually, you know, every family so far that has taken part in these activities, I mean, yeah, it might just be luck, but, you know, if there's 23 families turned up and said, yeah, we're willing to try this, and they've seen a massive difference, you know, it's showing that there's something definitely in this. We're now going to launch officially in 6 days, but we're working with lots of charities, we're working with a number of other institutions, but what we'd really like to do is to really test the intervention and we'd love to find an NHS partner or a social care partner to really help us test this to find out whether or not it is as genuinely effective as we think it is. Because this could make such a massive difference to young people and their mental health. We could absolutely get in there at the very early stages to stop their mental health deteriorating. And if nothing else, what we are doing is getting parents in a better frame of mind to really help the young person. So if the young person does need more intervention and more treatment, you know, what we say is that this potentially changes the waiting list to the preparation list and can really make such a huge difference. These are some of our charities and organisations that we've been working with so far and that are actually using our programmes over the next few weeks. And as you can see, we're working with the University of Oxford, University of Porto, and the University of Zurich. And they're going to be sort of helping us evaluate the programmes and take the work forward. Because one of the things that we've also found is that as we've gone out and sort of shared the work with people, is that many other countries are very interested in what we're doing. And we've been approached by the US, but we really want it to work here in the UK first and foremost, because, you know, that's where the families are that we really want to help on a day-to-day basis. And so if you want any more information, I'll be around over lunchtime. My colleague Gemma, I don't know where Gemma is now, over there in the back. So please come and talk to us. By all means, contact us. And if you use that QR code, you can sign up for our newsletter. So, thank you. I almost got you on time for lunch. Thank you.